Horses are big animals, and recovery from anesthesia is a big event with a lot of risk. And so over the last 10 years, many surgeries and procedures have moved to standing procedures with sedation and blocks, so anesthetic blocks that help them not to feel the procedure. One of the tough parts is that imaging is mostly, at least advanced imaging like CT and MRI, has been mostly done under general anesthesia. So this is a big step for us.
The standing CT has really changed the way we operate. We're able to now perform the imaging standing that we always had to anesthetize our patients for. And very often clients decided not to perform the CT on anesthetized animals because we actually did the surgery standing.
What really the CT allows us is it removes a lot of questions. So we may look at a case like here where we have very complicated x-rays where we're not entirely sure what's going on. And now with the CT, because the detail's better, because there's no longer superposition, we can say, okay, now this is the problem. It's the tooth in this case, or no, there's something else going on in the sinus. And it changes the way really that the surgeons may decide to approach a case.
So you would walk the horse into the stocks, and there's a kind of scissor table that's underneath the stocks, and that scissor table is in a pit, and the scissor table lowers down so that the horse's head is level with the hole or the bore in the CT. And then the CT moves back and forth over the horse's head to image the head.
So the CT has really improved our ability to look at the complicated structures within the horse's head, because now instead of looking at something which is a very complicated structure that's been flattened into two dimensions, we can look at it in a cross-sectional nature. So now we don't have any more superimposition like we had with radiographs. We can now see all the anatomy much more clearly.
We will be able to do more minimally invasive procedures since we can pinpoint the problem on a CT. We can accurately place our approaches to the problem and minimize trauma to the surrounding tissues.
The NC State Veterinary Hospital has three important roles, and that's to provide patient care, education, and push the limits or expand the limits of medicine based on scholarly activity. So when we get this type of equipment that can impact all of those areas, and specifically providing excellent patient care, but also training the next generation of veterinary clinicians and scientists, it's very, very important to us.